Did you know that over 54 million adults in the U.S. live with arthritis pain? If you're one of them, you're not alone, and today we're here to help you understand and manage it better. The goal of this video is to give you effective strategies for managing arthritis pain. We'll explore various treatment options, lifestyle adjustments, and self-care practices that can ease your symptoms and improve your quality of life. So, what exactly is arthritis? It's not just a single disease. It's a broad term for over 100 different conditions that affect your joints, causing pain and stiffness. These can range from simple wear and tear injuries to complex autoimmune disorders, all leading to joint inflammation and discomfort. The most common types you'll hear about are osteoarthritis and rheumatoid arthritis. Let's break them down. Osteoarthritis, or OA, is the most widespread form. It happens when the cartilage, that smooth, cushiony tissue at the ends of your bones, starts to break down. Think of it as a wear and tear condition. It mainly affects weight-bearing joints like your knees, hips, and spine. As the cartilage wears away, bones can start to rub against each other, causing pain and stiffness. Then there's rheumatoid arthritis, or RA. This one is different. It's an autoimmune disorder. That means your own immune system mistakenly attacks the lining of your joints. This creates chronic inflammation that can lead to joint damage and even deformities over time. Unlike OA, which is more common in older adults, RA can strike at any age and often affects smaller joints like those in your hands and feet. The symptoms of arthritis are pretty consistent across the board: joint pain, swelling, stiffness, and a decreased range of motion. How severe these symptoms are really depends on the type of arthritis and how advanced it is. The pain often feels worse after you've been still for a while, like first thing in the morning. That stiffness can make simple daily activities feel like a real challenge. For some types like RA, you might also experience body-wide symptoms like fatigue and fever, which can really impact your overall health. Now, let's talk about what causes arthritis and who's most at risk. The causes are varied. A big one is genetic predisposition, meaning it can run in families. Joint injuries, whether from an accident or just repetitive strain over time, can speed up cartilage breakdown and bring on osteoarthritis. Obesity is another major factor, as extra weight puts more stress on your joints, especially the ones that carry your body. And of course, the natural aging process itself wears down our joint tissues, making age a significant risk factor. So the key risk factors to keep in mind are age, family history, and any previous joint injuries. But lifestyle also plays a huge role. Things like obesity and not getting enough exercise can contribute by adding strain and reducing your joints' resilience. Even certain jobs that involve repetitive movements can increase your risk. So, when should you see a doctor? If you're dealing with persistent joint pain, swelling, or stiffness that sticks around for more than a few days or starts getting in the way of your daily life, it's time to make an appointment. Getting an early diagnosis and starting treatment can prevent further damage and make a huge difference in your quality of life. And if you experience severe joint pain, major swelling, a sudden loss of mobility, or if your symptoms come with a fever or unexplained weight loss, seek medical attention right away. To diagnose arthritis, doctors use a few different methods. They'll start with a physical exam, checking your joints for swelling, warmth, and redness, and they'll test your range of motion while asking about your symptoms and medical history. Next, they might use imaging tests like X-ray, MRs, or ultrasounds to get a clear picture of what's happening inside your joints. These can reveal cartilage loss or bone damage. Finally, lab tests can be very helpful. Blood tests can spot markers of inflammation or specific antibodies linked to types like rheumatoid arthritis. Sometimes they might even analyze the fluid from a swollen joint to pinpoint the exact form of arthritis you have. Once you have a diagnosis, what are the treatment options? Let's start with medical treatments. Often, the first line of defense is medication to reduce inflammation and relieve pain. Over-the-counter nonsteroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen and naproxen, are common choices. For more severe symptoms, your doctor might prescribe stronger NSAIDs, but you'll need to be mindful of potential side effects. For inflammatory types like rheumatoid arthritis, doctors often prescribe disease-modifying anti-rheumatic drugs, or DMARDs. These medications, like methotrexate, work to slow down the disease and prevent permanent joint damage. Starting them early is key. For cases where traditional DMARDs aren't enough, there are biologic response modifiers. These advanced drugs target specific parts of the immune system that cause inflammation. But treatment isn't just about medication. Lifestyle changes are absolutely essential. Your diet plays a big role. Eating a balanced diet full of anti-inflammatory foods like fruits, vegetables, whole grains, and omega-3 fatty acids can help. It's also a good idea to cut back on processed foods and sugar. Regular exercise is crucial. It strengthens the muscles that support your joints, improves flexibility, and reduces pain. You don't have to run a marathon. Low-impact activities like walking, swimming, or cycling are fantastic. Exercise also helps maintain joint function. Managing your weight is another game changer. Maintaining a healthy weight takes a lot of pressure off your knees and hips. Even losing a small amount of weight can significantly reduce pain and improve your mobility. And don't forget physical therapy. A physical therapist can create a personalized exercise program to strengthen your muscles and improve your range of motion, teaching you how to protect your joints for the long haul. Beyond conventional medicine, many people find relief with alternative therapies. Acupuncture, for example, may help some people with pain relief by stimulating nerves and muscles. Dietary supplements like glucosamine and chondroitin are popular, though their effectiveness is still debated. Omega-3 South from fish oil are well known for their anti-inflammatory properties. Other therapies like massage, yoga, and meditation can also help you manage stress and pain. Just be sure to talk to your doctor before starting any new therapy to make sure it is safe for you. Now let's dive into some practical pain management techniques. Over-the-counter pain relievers are a common starting point. Medications like acetaminophen can help with mild to moderate pain, while NSAIDs like ibuprofen or naproxen are great for tackling both pain and inflammation. Just remember to use them as directed to avoid side effects. Heat and cold therapy can also bring a lot of relief. Applying heat with a warm towel or heating pad can relax tight muscles and ease stiffness, which is great before you get moving. On the other hand, cold therapy with an ice pack can reduce inflammation and numb sharp pain, especially after activity or during a flare-up. You can even alternate between them for the best results. Don't overlook the power of assistive devices. Braces or splints can support and stabilize a painful joint, making movement easier. A cane can take some of the weight off your hips and knees, making walking less painful. And orthopedic shoes or inserts can provide extra cushioning and support. Just make sure they're fitted properly. Finally, remember that stress can make pain worse. Relaxation techniques can be a powerful tool. Meditation and deep breathing exercises help calm your mind and reduce stress. Gentle yoga can improve your flexibility and joint function while also reducing pain. By practicing these techniques regularly, you can gain a better sense of control over your pain and improve your overall well-being. Understanding arthritis and all the ways to manage it can truly enhance your quality of life. From medical treatments and lifestyle adjustments to simple pain management techniques, there are so many options to help you stay active and feel better. If you found this video helpful, please give it a thumbs up, share it with others who might benefit, and subscribe to our channel for more health tips and updates. Thanks for watching.